Brentt Leakes, who is the son of reality star Ne Leakes, has had a stroke and a bout of congestive heart failure. He is 23 years old. This is according to his mother, Ne Leakes. She talked about in an Instagram post. Apparently, he developed congestive heart failure and a stroke about 2 weeks ago. I watched her Instagram post about this. It's been reported widely by the news, and I wanted to come and talk to you a little bit about what congestive heart failure and strokes are. As you can imagine, he's very young, and the first thing we need to say and we need to make sure that we're doing is wishing him, Ne, their whole family well, and that we send up lots of prayers so that he gets better. Ne sort of implies that he's still under the care of doctors, saying that he's improving, but it doesn't sound like he's out of the woods. Now, as a family medicine doctor, the first thing I think about is a 23-year-old having congestive heart failure and a stroke. Those are huge things for anyone to have, but certainly we often don't think about a 23-year-old having those. Of course, I'm not his physician and I'm not even involved in the case, but things that Ne talked about in her Instagram post, she said that a lot of people have been asking her about what could have caused this. She made reference to, in particular, the fact that her son does not do any drugs or drink alcohol, because that is one thing that certainly many would wonder, even medical professionals would wonder, is this playing a role? She says he doesn't drink or do drugs. She also said that she'd been asked by a lot of her friends and people she knew if his weight played a role in the conditions that he got. And she said that doctors didn't seem to imply that that might have been the case. She did say that doctors were wondering about COVID, meaning if he had had a COVID bout at some point, maybe didn't realize it, and this could be sort of sequela or somehow related to that, or if there could be something sort of underlying or genetic or passed through families, or something he was born with, maybe that he didn't know. The thing about it is congestive heart failure is when our heart does not pump enough blood to meet the demands of our body. That can happen for a number of reasons, and often when congestive heart failure happens, people experience symptoms such as shortness of breath. They may get what we call volume overloaded, have excess fluid in their body, get puffy, swollen, other symptoms as well. And strokes, as you guys are probably familiar with, is when we have a lack of oxygen to the brain, and that can cause a number of symptoms in and of itself. There's a lot of questions here. Of course, we don't know the full story, but for a 23-year-old to have congestive heart failure and a stroke is a really big deal, just like it is for anyone. There are a number of things that could be going on. When I, as a physician, think about this, I do wonder about genetic causes, something underlying, something. I mean, honestly, the possibilities are endless, but it sounds like he's receiving appropriate medical care, which is the most important thing. The other important thing is that we all wish them well, that we send up prayers. One of the reasons why I talk about health stories that celebrities share is because I think it's an opportunity for us all to do some self-reflection, to not only pray for those who are affected, but to also to think about, are we taking care of ourselves? Are we seeing our doctor regularly? Are we getting regular checkups? Have we had any symptoms that maybe we haven't gotten looked at that we should? Brent, we are with you 100%. Ne, we are with you as well, and your entire family and friends and everyone who loves Brent. We are certainly wishing you all well. As always, I say, for those who share their health stories, they don't have to do this. I think it's a blessing that they do. It's a gift for the rest of us to be reminded of our own health and the importance of staying on top of that. So anyway, I'll keep you guys updated as I learn more, as we learn more, and anything that may be helpful. But until then, Brent, please feel better soon.